what is 5G technology? Now we are hearing this has become, like in the past few months, everybody is talking about 5G technology, right? In Jio, Airtel, and some of the people are bringing it shortly in the next few months in India. What is this 5G technology in healthcare? How is it going to help us? Now, healthcare is considered as a part of industrial revolution. Healthcare is now has become an industry, but with the human touch being maintained. Now, if you see the industrial revolutions, right from industrial revolution 1 with the coal based industries, then the electricity, second industrial. So, all the revolutions have occurred 100 years apart roughly. The second industrial revolution is electricity based industrial revolution. The third is internet. Internet has brought in a lot of change in everybody's life. But now, the fourth industrial revolution is 5G, Internet of Things, intelligent machines, robots, big data analytics, deep learning, machine learning, artificial intelligence. So, all these are applicable in health sector, and these are going to bring in enormous change in the healthcare delivery, and most importantly the cost effectiveness, number one. Number two, the asset management and the resource optimization. And this, with the same resources, probably we will be able to provide 50 to 100 times better healthcare delivery even for the people living in the remotest areas. So, this is what the 5G is going to bring in, and sitting here you can do surgery elsewhere in US. So, the latency will come down with this 5G almost 10 to 20 times more download, and similar upload timings are cut down with this. And now, in the ICU-CUs, intensive care units, in the critical care units, where the noise of the monitors is there, we can make quiet ICUs without noise, and cutting down the number of sisters and the infection rates. With the Internet of Things, the sensor is there, a platform is there, then it is transmitted to the central command station, where the doctor can advise what is happening and interpret, and so that a very quick action. And the second set of eyes, there is a fatigue in the nurses in the ICUs and elsewhere while watching the monitors, whereas with the 5G technology and with the central command station telemedicine, the second set of eyes which is not fatigued, especially with other instruments, and we can have a continuous monitoring of the patients. We can predict and prevent the sudden cardiac death in hospital, either in emergency room, operation theatres, post-op wards or other wards. Now, the two technologies which have brought in lot of change and which are likely to bring down the incidence of sudden cardiac death, which are likely to predict the coronary artery disease in the coming 2-3 years is, one is the major invention of the century in the diagnosis of coronary artery disease, that is CT coronary angiogram, by which you will do calcium score and also the cholesterol plots. Number two, the telecardiology, the ambulances, the transport, and treating first aid, giving first aid or giving clot buster injections even in the villages by transmitting an ECG through your telemedicine. So, this is what is going to happen. The delay is now cut down, and the golden hour, the concept of golden hour and platinum minutes, which is being propagated for the past decade, now it is picking up, and with the technology, even the remotest people in Brazil, in Africa, in Ghana, where underprivileged countries are there, they are likely to get equitable health care if the resources are optimally utilized, which will be cost effective, it will save lives, it will prolong the productive period of lives, and cut down the disability adjusted life years, and cut down this suffering, economic losses, and all these things.